Hey, thanks for taking a minute to watch this video. We're going to talk about a very, very sensitive subject, and that's sensitive teeth. And this is one that really strikes a chord with me. My entire life, I have suffered with sensitive teeth. A report a few years ago from WebMD said almost 1 in 8 adults, maybe more now, suffer with sensitive teeth. And, as a kid and as an adult, biting a popsicle was nearly impossible for me. So, I see people do that and I'm amazed, but it sends chills up my spine to this day because, my teeth are very sensitive and I can eat a popsicle, but I have to do it, a little more careful. Unfortunately, I don't really like popsicles, so it's not a huge loss for me. But if you do enjoy popsicles or cold foods or hot foods or the things you really love, sensitive teeth can be a big issue. And our teeth are really pretty amazing if you think about it. If you were to heat up the sidewalk and then pour ice water on it, that would cause some problems, probably cracking or pitting of the concrete, which is why we see our roads and our sidewalks, broken up. In Utah, we have a lot of extremes in temperatures, cold winters with snow and then hot summers. So you can imagine if you're drinking, hot coffee or hot chocolate or drinking, eating some warm soup, and then you wash it down with some cold ice water or cold ice cream or some kind of dessert, you can imagine that can be very hard on your teeth. But there are some things you can do, which we'll go through here. And really it comes down to, do you want to do more of the work on your own and possibly save some money, or would you prefer we do more of the work for you? All right. So your three kind of options you have. The first one is where we do more of the work, the most amount of work, and you just need to be here present as a patient. We'll take care of the rest. And what that involves is gum therapy. All right. So a lot of adults, at least half, if you're 65 or older, that number goes to 60 to 75%, have some form of gum disease. And that could be gingivitis, or that can be full gum disease. And gum disease, besides causing bad breath, tooth discoloration, it also causes sensitivity. It's the number one reason for loss of teeth in adults today. So gum therapy is often the best treatment, and sometimes coupled with some other things. And if you have a lot of receded gums, you may want to also get a gum graft, and that's where we add gums back to your roots that are discolored or that are showing to cover up those very sensitive areas. The enamel of your teeth, the white part of your teeth, is very hard and smooth, and it doesn't get sensitive like the roots of our teeth do that have thousands of little nerves on them that can become very sensitive. So gum therapy, possibly gum grafting, is going to be the best option, or some gingivitis therapy if you don't have full gum disease. Okay. Now the second option, which also involves us in the office, but it's less invasive, that is bonded sealants and bonded desensitizers. Okay. And these are coatings that we apply to your teeth. They are clear or white. And what they do is they cover those parts of your teeth that are sensitive or have pits in them or brown or discolored, and they cover those up. And those usually last anywhere from 3 to 24 months. All right. So when you get a desensitizer or a sealant, we'd expect the benefits to last anywhere from 2 to 15 years. A recent study came out that was showing that if you had your teeth sealed, it actually provided 15 years of life, 15 years of benefits on your teeth, which is why most of our adult and children patients choose to have sealants placed on their teeth. But the desensitizers can also be placed on your roots. That's a coating we apply in the office. And then we would have you come in every 3 to 4 months for a fluoride varnish treatment. This is an application. We use a little tiny paintbrush. We paint it on your teeth. It's a very, very concentrated fluoride, calcium, and xylitol combination. When it's painted on your teeth, it helps resist cavities and bad breath and keeps your teeth white. Most importantly, it really coats those sensitive areas, because not only are they more prone to sensitivity, they're more prone to decay. And if you have decayed teeth, we would also look at that, fixing cavities or old caps, crowns, root canals, teeth that are chipped, or a lot of our patients have worn teeth from grinding or clenching. If we restore and fix those areas, that often decreases or completely erases the sensitivity. So the first and the second options I gave you are kind of things we do more in the office. The third one is, if you want to do the most cost-effective option, we can make a kit for you. And this will require that you do a little more work on your own. You probably have to do this anywhere from 3 to 7 days per week, but it works really well. And I will say, I've done all three of these options personally. Genetically, in my family, we get receded gums. And even though I've never been diagnosed with gum disease, I haven't had pocketing, I have for a long time have receded gums. And before I knew better, I would actually brush those areas harder, which was very damaging and destructive to those sensitive roots. So once I got into dentistry, I learned better and came up with some better ways. So one thing that we do quite often that I'll show you here is a special sensitivity tray. Okay, we make a tray that looks like this. It's either kind of a hard or semi-flexible tray, and it's similar to what you would use for teeth whitening or for Invisalign or clear braces that we do, those kind of things. But with these trays, what you would do is you would brush your teeth first, okay? Clean your teeth, gently massage, okay? Many people are brushing their gums too hard, all right? And remember, your enamel is hard and smooth. Think of it like a polished, smooth rock. It's easy to clean. But your gums and your roots below them, those are much softer and much more sensitive, so don't brush too hard. We have a brush that we carry in the office that if you push too hard, it'll actually flash a red light or shut down, and that helps people prevent from brushing too hard. If you're gonna use a manual brush, which are okay too, I would just recommend a soft or a very soft brush. Medium or hard bristles are maybe okay for cleaning toilets or cleaning the wheels on your car. Don't use them on your teeth. They're too damaging. It's not gonna make your teeth whiter, no matter what the commercials say. It's not gonna clean better. In fact, soft bristles clean better because when you press them on your teeth gently, they actually kind of fold and they push into the hard to reach places and wipe them better, right? But I'm gonna take my whitening tray here, and then what I would do is I would take a tube of a prescription toothpaste, okay? And I would squirt a couple dots right along the inside here, okay? And a couple pea-size amounts, thin them out, then I lightly kind of smear it so it's consistent there. And then I'm gonna put that tray in my mouth and I'm gonna wear it for 15 or 20 minutes. And what I typically do is I will put it in before I'm getting dressed or ready or shower for the day. So we call it the toothbrush shampoo. We also do this if you've had braces or you wear a retainer that looks anything like this. We advise that for the rest of your life, you wear it 10 to 15 minutes a day, and you can kill two birds with one stone, so to speak, by also doing a desensitizer at the same time. And the gel we have or the paste, they work really well. A regular one works okay, but the prescription ones tend to work a lot better because they have a lot more minerals and they're a lot gentler on your teeth. They can be a little hard to find, but we've done some research and found the best ones, and we carry them here in the office. So with the desensitizers, with the toothpaste, I do it for a couple reasons. Personally, I still have sensitive teeth, although I've managed it pretty well, but also because I've had quite a bit of dental work done. I want to wear these so that that toothpaste and those minerals can push up between my back teeth in those flossing areas, and they're being soaked and coated with a fluoride, calcium, xylitol, or a combination of the three treatment. And that's pretty cool because it's kind of like a home version of what we can do for you in the office. So the office one's the best, but for maintenance and for long-term use, we can do that, and it works really, really well. This also works great if your teeth become sensitive after whitening. So if you ever whitened your teeth and had some sensitivity after, we do have some newer whitening gels that we use, and I really love them because I don't get the sensitivity with those, and I'm a wimp. If I can do this, you can do this for sure, because I am a wimp with sensitivity. But if you did have some sensitivity, or you just wanted an extra boost of protection, after you whiten, you take this same tray, put that prescription gel in there, wear it for 15 to 20 minutes, top and bottom at the same time. You can go about, cleaning your house or, running an errand, getting dressed for the day, whatever it is. And when you take those out, you just simply spit and don't rinse for another 15 or so minutes. That way that coating just stays on there for a while, and that really gives your teeth a supercharged boost. So we know sensitivity isn't fun. We know that sometimes throughout this process, your teeth will remain sensitive for some time, but it tends to taper off. And using a combination of these, along with some home care kits we have in the office, if you're interested, give us a call, or at your next visit you can ask. But we have prepared some home preventative care kits that involve, a combination of all the tools you need in order to make this happen, which includes, trays, prescription gels, the toothbrushes, the picks, the irrigators, all those kind of things that work fantastic. And you can talk with a member of our hygiene team about that. Because the gel is a prescription, we'll just need to see you in the office first if you're not already a patient. If you're an existing patient, you can call and we can have a phone conversation about it, or you're welcome to call us and we can do a consultation about our home care products and what you can do to be less sensitive. But I hope this video has helped. Hopefully I've given you some things that, examples I use, and you can go home today and start having less sensitive teeth. So thanks for watching, and we'll see you next time.